All right, good afternoon, ladies and gentlemen. I'd like to welcome everybody to this Tuesday, February the 16th, 2021 meeting of the Board of Garrett County Commissioners. Thank everybody for tuning in. I'd like to call this meeting to order. Mr. Knoll, are there any additions, deletions, or changes to the public meeting agenda? No, sir. Hearing none, we have a motion to approve the meeting agenda. So we have a motion, have a second.
Second.
Motion second, agenda approved by mutual consent. Everybody got a copy of the minutes in advance of the meeting, or any additions, corrections, concerns to minutes? Hearing none, we have a motion to accept the minutes.
So moved.
We have a motion, we have a second.
Second.
Motion second, minutes approved by mutual consent. The first item on a relatively thin agenda today is an update, COVID-19 update by the Garrett County Health Department and Bob Stevens. Bob, thanks for joining us again as always, and what can you tell us?
Okay, can you hear me?
Yes.
Okay, thank you. So yeah, the update for the most part is positive. We do have a couple glitches. Currently we have 1,832 cases and 57 deaths. We also have the lowest positivity rate in the state. And I'm going to share my screen right now, if I can. See if I can do this. If you will enable me to share my screen, I will, but if not, I'll just talk my way through it. So I'll just talk about a few of the.
You should be able to go. Should be good to go. Are you coming up?
No, it says it's disabled. That's all right. I'll just talk my way through this. You don't need to see the visuals. You can just you can go back to wherever it was. Currently we have the lowest positivity rate in the state. That's 2.26%. And our case rate is always also the lowest in the state. So that's 4.43 per 100,000. So that's very good. That's really been a dramatic turnaround from about a month ago. We're currently in phase 1C of the vaccine priority group. And we're prioritizing it in that 1C group, the senior citizens over 65 years old. Of course, the people that can still get a vaccine that are in that group in phase 1A and 1B include the medical public safety group, anybody over age 65 and educators. Now I say you can get a vaccine, that's if you can find one. Right now, 15% of our population is vaccinated. That's pretty good. That's higher than the state average. We're receiving 300 new doses a week, as reported before. We have the Moderna vaccine, so it's a 2-dose sequence. So each week we're supposed to receive the new doses as well as the vaccine for those people who need their second vaccine. This week, the shipment was delayed from the federal government. So that was delayed, I think, partially probably because of the federal holiday, but also because of the weather. And so the good news is we're still going to be able to do the vaccine clinic that we have scheduled tomorrow. But the only reason we can do that is because we are borrowing vaccine from Garrett Regional Medical Center. They've been gracious enough to provide that to us. We had virtually I think we've received 5,600 doses, and we have dispensed 5,600 doses as a health department. Other places that it's available currently is Walmart and Mount Laurel Medical Center. Now, Walmart previously had been taking local appointments, but that's now been moved to a corporate level. And I'm not really too keen on that, because I'm afraid that people will, on that corporate level, they'll be able to register for those vaccinations from wherever. It could be anywhere where they have an internet connection. So it remains to be seen what will happen with that. There's a couple rumors out there that Walgreens and CVS have the vaccine, and they do not at this point. I think Walgreens is taking some reservations, but they don't have the vaccine yet. They've been given vaccine through the federal pharmacy program, it's chain pharmacy program, and so it goes directly to them rather than going through the state. We're also in the midst of having discussions with the state on trying to get a mass vaccination clinic in Western Maryland. So John Frank, who's the EMS director, of course, you know that, in Garrett County, and our peers in Allegheny, at the Allegheny County Health Department and Emergency Management, are working to try to assure that the clinic is truly in Western Maryland. And we'd like them to use our sites, and we've offered our sites up, but we haven't heard anything else on that. But we think that's really important, because if they consider Western Maryland to be Hagerstown, well, as we all know, it's Hagerstown is closer to Baltimore than Garrett County is closer to Hagerstown. So it's still a long hike for people who need that vaccine. The state does have 2 mass vaccine sites already set up. One is at the Baltimore Convention Center, and the other is at Six Flags in Prince George's County. And I would tell people that if you're worried and you don't fit into that 1C priority group, and you're worried about getting a vaccine, that's what these mass vaccine sites have been set up for, and they're supposed to have 5 around the state. Local health departments have really, we're only receiving about half the vaccine that's coming into Garrett County. As I mentioned, Walmart gets that, as well as Mountain Laurel. We're really the experts when it comes to getting the vax to the persons who need it the most, and on a population basis. So that means it doesn't matter. All the person needs to be is from Garrett County. It doesn't matter what their insurance is. But we also want to stress, and we're very good at trying to track down the people who are the most needy of that vaccine in order to help them survive and not get COVID. So we have a lot of different players. There's going to be a lot more players that are on the scene. And right now, it's like having a lot of individual musicians, but what we really need is a symphony. And that's just not happening, because it seems like everything is disjointed. We're moving in that direction, of course. Like I said, we have this collaboration with the hospital, and a good collaboration with Mountain Laurel to try to make sure that the vaccine coming here goes to who needs it. You might have heard that the Johnson & Johnson vaccine is coming online sometime soon, once it gets to the emergency use authorization. A lot of people, some people really want that vaccine because you can get it with 1 dose. You don't have to get 2 doses, much easier to deal with. But it says that, but the research says that it's less effective. But what I want to emphasize with that is, when they're saying that it's less effective for somebody getting the illness. So you'd have a more likely chance of possibly being infected with COVID if you've had the Johnson & Johnson vaccine as opposed to one of the mRNA vaccines. But the Johnson & Johnson vaccine is just as effective, the research is showing, in preventing hospitalizations and death. So when people who are getting that vaccine they're more likely to be test positive for COVID and maybe show signs and symptoms and maybe feel ill for a few days, but it also protects them from going in the hospital, being hospitalized, going to ICU, and also death. And so it's really important that we stress this, because what you've probably noticed is what feels like the goalposts are being moved because we have these new strains that are coming out of Great Britain and South Africa. And those strains are more infectious and they're more deadly. And so because of those things, it's really important that we continue to do the things that we've been doing all along, trying to make sure that we have the face coverings, trying to, avoid large gatherings when we can, try to keep that social distance, because the problem will be is if one of those strains becomes prevalent in Garrett County or in our region, we would likely see a kind of another surge. And so we're really hoping that more and more people can be vaccinated during that time. If you just look at what we can do here at the health department, if they're saying that by April that those strains will be the most predominant strains. By that time in April, if we give 300 doses a week, we ought to be able to be close to 25% of our population would be vaccinated by that point. It could be a little bit higher if more people are able to access through a mass vaccination clinic or, through Walmart or one of the pharmacies. I would tell people that it really is important to get that vaccine, because we don't want to see the county go through the kind of the situation we were in just 6 or 8 weeks ago, where we had people every day. It seemed like somebody was dying from a COVID-related death. Our numbers kept going up. Fortunately, right now things are looking very good. We're hoping that as we move forward, we're hopeful, but we're also very cautious about that. So I'll take any questions you might have now.
Anybody got any questions for Bob?
Bob, when you say that Walmart has moved the reservation process to corporate, what does that mean?
I have not tried to register through that, but I do know that originally they were taking actually appointments. People were calling by phone into the Walmart here. And so when you do that, logically people would, when they find out about it, they'll go online and get that. But when you have it where it's corporately, then it goes on websites, and people can register for that. The same way these mass vaccination clinics, you could get an appointment at Six Flags or the Baltimore Convention Center as easily as somebody who lives, right down the street from one of those locations. But then you'd have to drive there, and so it sort of defeats the purpose that it's not a local pharmacy, that it doesn't have local input. We take our reservations through the internet, and we also have a hotline when we do have vaccine available. I do want to speak about that for a minute, though. And so by only doing it through what we call, kind of a closed cycle, we're able to really target Garrett County and not have all these people show up on coming in to get vaccine from all over the state or all over the tri-state region. That most of the people that are coming in are from Garrett County. They either work here, they own property here, or they live here, and they reside here. So that's a real challenge. I did want to let people know that currently we don't have. If you go to our website, you'll see that we don't have any appointments that are available. You can call our hotline, but they'll tell you the same thing. We don't have any appointments available right now. We've really scheduled out everything that we have until really the 1st of March. And so sometime between now and the 1st of March, we may open up some appointments, but I don't think that's going to happen this week unless for some reason all of a sudden a bunch of vaccines were given to us. But the state has said that we're receiving 300 a week, and we have booked 300 appointments a week for the next 3 weeks.
All right, thank you. Any other questions for Bob?
Just answered one I had.
All right. Well, all right, Bob, if you don't have anything else, we appreciate, as always, you joining us and giving us an update, and I'm sure we'll see you next meeting.
Okay, thank you very much. Have a good day.
Thank you. All right, next item on the agenda, we have some board appointments for the Garrett County Local Emergency Planning Committee. Mr. Knoll, what do you have for us?
Yes, sir. These are appointments to the Garrett County Local Emergency Planning Committee. These are appointments for 2-year terms. These are actually ratifications of appointments that the various departments and organizations make to this committee. Again, members are appointed by their respective agencies, and the request is to ratify the reappointments for a 2-year term.
All right, so every single member's up for reappointment, and all of them are picked by their own group or organization. So I'm assuming they're all willing to serve. We'll take them all at one time. If anybody in the general public would like to know who serves on this, you can go online and check it out, or give a call here in the office and we can provide you with a copy. It's the Garrett County Local Emergency Planning Committee for a 2-year term from 2021 to 2023. Everybody has a copy of that list. Are there any questions or concerns about that? And if not, if we could have a motion to approve the slate.
Motion to approve.
All right, we have a motion, we have a second.
Second.
Motion and a second, question on the motion. All those in favor say aye. Opposed, motion carries, and all of those individuals have been approved. Now for the final item on the agenda, before we go to announcements, I do want to welcome Jeff Fellers, the director of the Tucker County Foundation that does the Run For It event that we've partnered with over the last several years. And Jeff, I'll turn it over to you, buddy.
Well, thank you, gentlemen. I just wanted to come before you again this year. You guys have been gracious since back in 2014 when you started supporting the Run For It event, which ultimately helps nonprofits in the county of Garrett and other counties as well. Obviously, you know, the money you guys have helped us with goes directly into Garrett County. So we're planning for the event to be hopefully, you know, live this year in September, on September 25th, barring any, you know, outbreaks again of COVID and shutdowns of these mass type of functions. But as of right now, we're planning on having the race live. So we're coming before the different commissions asking for your support again. I know since 2014, the commission has invested $9,000 into Run For It, but in return has $80,000, over $80,000 has gone into Garrett County since then with that investment. Last year alone, $16,127.39 went into Garrett County, and we did it virtually last year. So people could, you know, walk and run on their own time and submit those through our automated site, so they could keep social distancing going on. So again, we're coming before you, just asking for your support, the same as you've always given in the past, I think, which was a $2,000 amount, and hopefully, you know, you guys can support us again this year.
All right, and you did send us a written request for that, correct?
I sent it to Mr. Null, I believe. Kevin, is it Kevin?
Yeah, you got it.
Yeah.
Yeah, we got it. And I think, all right, you want to go ahead and just do a motion and do it now?
May as well.
Okay, so we'll go ahead, Jeff, and take care of that right now while we're live, and I'll entertain a motion to fund the Run For It event in Tucker County at the levels that we funded for last year, $2,000. So we have a motion, we have a second. Motion second, question on the motion. All those in favor say aye.
Aye.
Opposed, motion carries. We'll make sure you get the check, and we appreciate the partnership.
Thank you so much, guys.
All right, thank you very much. Appreciate you joining us today. All right, that brings us to the conclusion of our agenda. I do want to say the next scheduled public meeting will be Monday, March 1st. That'll be virtual again. And if no one has any other announcements, take a motion to adjourn.
Move.
Meeting adjourned. Thank you very much.